the spotlight. In the spotlight.
Greetings and welcome to HASC's In the Spotlight podcast, where we bring you conversations with healthcare leaders and innovators who are shaping the future of healthcare in Southern California. I'm Adam Blackstone with the Hospital Association of Southern California, or HASC, and today we're talking about how data and technology are transforming hospital operations and patient outcomes. I'm joined today by Jeff Pratt from SpeedTrack, one of HASC's endorsed business partners, or EBPs. You'll hear us probably use that term, so that's what that acronym is. And John Chapman, CEO of San Antonio Regional Hospital. Jeff, John, thank you so much for joining us today and welcome.
Thanks for having me.
Thanks for the invite, Adam.
Great. So let's go ahead, Jeff, and we'll start off with you. And I know SpeedTrack because you guys are an endorsed business partner of HASC. But for our listeners, what does that endorsement mean? How long have you been an EBP? And how has SpeedTrack built relationships with Southern California's healthcare community and specifically our hospitals?
That's a big question. First off, I'd like to thank you for telling me what an EBP is because I hadn't heard that term before. But in terms of HASC, it's been a great journey. It really happened organically. We started in healthcare. We are a technology company. We built and patented a new platform for analytics, but just through happenstance and mutual connections, we started in healthcare. And so through that pathway, we got on HASC's radar, and they reached out to us through some mutual friends, and we started having meetings with HASC, and we started the relationship as an endorsed business partner a few years ago. And what it's meant to SpeedTrack is, God, it's meant so much to SpeedTrack. Let me start off by saying that our company, because we're focused on technology, we're not subject matter experts in healthcare. So it really opened up the window for us to build relationships with subject matter experts in healthcare. So we work directly with CEOs, with service line directors, with physicians, and they really drive the development of what we're doing. In fact, maybe later on after the podcast, I've got something I want to bounce off John, a new pilot we want to try. And, that's what really drives the company. So to get back to your question in terms of being an endorsed business partner, it opened up a lot of doors. It helped us really understand context in the area of healthcare. It introduced us to a lot of new people. And of course, the bottom line is it helped us grow our business.
Great.
And that doesn't just happen. It has to come with trust. So I think that's a nice little check mark we can put next to the company because HASC has trust in us to endorse us. And that goes a long way.
Thanks for that, Jeff. And just out of curiosity, you mentioned that healthcare was one of the first sectors that you guys explored, SpeedTrack. What other sectors, maybe in the early stages of the development, were you guys dabbling in?
We also dabbled in law enforcement. Excuse me. It's funny, we built a very similar platform for police departments. And, it was a couple things. One is, they're publicly driven organizations. There's a lot of politics involved. It just was a difficult place to start gaining a lot of traction early. And, they were kind of competing with us in the beginning, but we got a lot more traction in healthcare more quickly. And so that's really become our focus. But another thing that came out of that, coincidentally, is there's a lot of similarities, both in the data. So if you think it sounds going to sound terrible, but if you think of criminals like patients, we manage and track these individuals, and both populations have their different idiosyncrasies, et cetera. And of course, the hospitals are trying to provide care to these individuals, and the police departments are trying to catch them. But, there was a lot of similarities in those two places. And then an interesting thing that started coming up recently with some of the counties we're talking to is it would be nice, although it would be very difficult from a political perspective, if we could intertwine those data sets. Because I think there's a correlation between public health and public safety. And, that's a conversation for the future.
Great. And so I've had a chance to kind of play around in SpeedTrack a little bit. But could you share with the listeners what sets SpeedTrack apart from other analytics platforms?
Yeah, I don't want to get too technical for a couple reasons. One is I'm not the technology guy here at SpeedTrack, but also, it can be very complicated and difficult to understand even for technical people because our solution is so unique. But the way I like to look at it is like the Starship Enterprise, if you will. Um, so we have this universe of information out there, and we want to be able to navigate to portions of the universe that are contextually important to us. Now, other technologies think they do that, and the way they do it is you either type in a query to the system or what have you, and it's already been preloaded to direct you to what they think the most relevant information is. But what if you're the better person to know what's relevant for you? So the way SpeedTrack works is rather than storing data, we actually store the information. And the way we do that is we break all the information down into its little bits and they're associated together. And so essentially what ends up happening is you become your own Captain Kirk of your starship, and you can navigate through the information, but also be shown other insights in the information that you may not have ever considered when you started your journey. It's kind of like when you start a road trip across the United States, you start encountering things that you didn't anticipate that you may want to explore further. And that's the difference with SpeedTrack. It allows you to make up your own mind, set your own direction, identify insights along the way. And the cool thing is it does it very quickly, as fast as you can think.
Amazing. And I'd imagine having access to all that information allows you to really put the patient first, right? Because you're assessing based off of your population of patients that you've either in real time or historically have encountered. And so you can adjust operations based off of what you're seeing within SpeedTrack.
Yeah. You can either start at either level, start at the population level and identify cohorts of patients with certain attributes, or you can start at the patient level and kind of zoom out and see what they have in common with other patients to identify correlations associated with that particular patient. So we're learning a lot. It's been a great adventure.
Awesome. Well, that's a good segue. Into John, because we were going to talk about the healthcare providers, but before we get too deep into that, John was hoping that you could share a little bit about yourself, your background, and your journey in healthcare.
Sure, Adam, that's fine. I was one of those pre-med students coming out of UC Berkeley who said, the heck with this. Ended up getting a bachelor's in microimmunology, a master's in business. Was at UCSF for 17 years, ran service lines, went across the bay, and was the COO for the opening up of the Highland Hospital of Alameda Health System in Oakland. And then was headhunted and recruited down here to turn around a nonprofit. And so far, so good. Everything's been doing well. As you know, Adam, I'm also the secretary for HASC, and I'm the CEO chair for the Inland Empire for HASC. And I believe, if I'm not mistaken, I'd recommended SpeedTrack to HASC as something to look at, and I'm glad I did.
I'm glad you did as well, John. Thanks for that. Very interesting background, but also interested in how San Antonio Regional is using SpeedTrack today, and maybe circling back to what we just discussed, how is it effective in being able to provide high quality care to your patient population?
Sure. When we first met Jeff and SpeedTrack, it was related to a community health needs assessment that we had done 2 years ago. And what I always want to do, and this is actually the strategic plan for HASC, is to go out and bring healthcare to the community by zip code. Now, what type of events do I want to have by zip code? Before it was subjective, what we think, perhaps based on interviews with patient populations there. But with SpeedTrack, I know exactly by zip code who's had cancer, who's had breast cancer, who's had prostate cancer, who has high blood pressure, how many people, were they treated, What were the outcomes? What was the age group? What was the ethnicity? And as an example, how we've used SpeedTrack recently in two areas. We went to Ontario, where the Christian churches are, the Catholic churches. We presented to the city council and saying, you know what? We want to bring a healthcare event that's meaningful to Ontario. We picked the churches. And what we offered were cardiologists there. We offered dietitians. We offered EKGs. We offered hemoglobin A1C testing to figure out who were the diabetics. And why did we pick those? Because we used SpeedTrack to figure out what were the top 5 health issues in that zip code and that area. And we found over 12 people who did not know they had diabetes. They're getting treated today. We did the same thing in Fontana, picked 2 zip codes, brought prostate-specific antigen to those because in that zip code, prostate cancer had a high incidence of finding. We got that looking through SpeedTrack. And we found 6 people with unidentified prostate cancer who hopefully will be alive tomorrow because of it. That's the community benefit portion. Then we said, okay, this is good. All right, what can we use for SpeedTrack for strategic planning? And healthcare CEOs are hit all the time by vendors. Hey, we recommend this equipment, we recommend that equipment, da 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 da. But we always needed a platform to validate, what's the incidence of findings for those diagnoses that make sense for a piece of equipment. So as an example, we were recently brought in a piece of equipment called Ion Robotics. And what it is and what they sold was, hey, that incidental finding in your lung when it's less than 5 millimeters? Right now, every doctor in America will say, we don't know what it is. It's small, it's incidental. We found it doing an imaging on your abdomen. Don't worry about it. We'll take a look at it in another 6 months. Well, what Ion Robotics allows you to do is actually go in and actually biopsy those specific small, less than 5 millimeter samples, which wasn't available before. And instead of someone waiting 6 months while a cancer can grow, we're able to tell that person right away at an early stage whether it's cancerous or non-cancerous. We did our first case using this, and it was based on looking at SpeedTrack and the incidence of lung cancer in our region to say, you know what, maybe this will benefit the health of our community by capturing lung cancer before it spreads, before it gets too large and it ends up in a morbidity or mortality statistic. Our first case we did 2 weeks ago, 3 millimeter nodule, turned out to be cancer. That person now is getting that removed through radiation oncology and is going to have a long life. So having that type of data at your fingertips with SpeedTrack is amazing decision support and strategic planning tools.
That's truly amazing. I don't know, Jeff, if you've heard that story, but just to hear that lives are potentially changed based off the platform that you've developed is
I hadn't heard
really
that
amazing.
specific one from John. Yeah, but I've heard a lot of other stories like that from CEOs and alike over the past several years. And it's just so gratifying. I mean, you can probably tell by looking at me, I'm grinning from ear to ear. That's what it's all about for me is to hear from our partners how our products are creating value for them. And, I intentionally use the word partner because from the very beginning, I refuse to consider, I'm not going to refer to them as users or customers. I don't want to be referred to as a vendor. As I said from the start, we're driven by our partnerships. John, based on what he just said and other conversations we're going to have in the future, is going to influence what we develop next, how we develop it. That's how we've grown from the very beginning. So, John, thank you. I appreciate your partnership very, very much. And it's a two-way street. I mean, that's That's the way we look at it. So our technology is probably the foundation. Our partnerships with folks like John is the framework. And I think the icing on the cake that really sets SpeedTrack apart, two things. Number one is because of the fact that we consider ourselves partners. If John called me tomorrow morning and said, I need this special report for a board meeting this afternoon, and we're not exactly sure how to do it, or my analyst is out, on maternity leave or whatever it is, we'll get our analyst on the call, understand what he needs, and he'll have it for that board meeting this afternoon. The platform comes with unlimited support and training, and that's how we roll. We develop that kind of service in addition to unique technology and let the partners tell us what to build next.
Great. Thanks for that, Jeff. Thanks for that, John. Switching gears a little bit. I know we were just talking about all the great stuff that technology does, but this is no secret to either of you that hospitals are just facing some of the greatest challenges in recent history, coming off of COVID, workforce shortages, increasing patient needs in various areas, behavioral health, addressing social determinants, and now declining reimbursement and challenges with legislation have made things even tougher. And so, John, from your perspective, what are some of your biggest challenges right now, and how might you seek to address them using SpeedTrack?
Well, I think every hospital has to take a look and decide which specialties, which programs they want to build. One hospital can't be an end-all be-all for every specialty. So it helps us, SpeedTrack helps us trend. You can do a SWOT analysis with SpeedTrack. Who are your competitors? What's the volume of cases for specific diagnosis or CPT codes, right? By specialty. Even the age of the providers that are already out there in terms of workforce strategy. I haven't used SpeedTrack yet for that, Jeff, but it's coming.
Okay, let me know, buddy.
Right? And it helps us determine what specialty we want to invest in and who do we need to make it successful. So as an example, I mentioned ion robotics, but we also saw the same thing using SpeedTrack for bringing in or planning to bring in a vascular program into San Antonio. Because it was few and far between, we found using SpeedTrack, and Adam Hask too, in terms of the slides we get, in terms of the number of seniors increasing over the last 15 years. Well, they come with vascular issues besides heart issues. And then we take a look of where are they getting treated? And if there's not a place in our community where we can bring that service to our community and they're traveling 30, 40, 50 miles to get it, that's something I want to invest in. So it really helps you be specific, metric driven, and helps us determine how are we going to move forward in the future to help with some of the hits that we are going to take with recent legislation.
Thanks for that, John. Jeff, so we mentioned the financial pressures, workforce shortages, increasing patient needs. How does SpeedTrack look to address those challenges, but especially for just putting the Inland Empire lens on things, since we're talking to John, how might it help in that area and in that region?
It's interesting you bring that up. So as I've been emphasizing since the beginning of this podcast, John and the other CEOs and partners that we work with are going to drive where we go, particularly right now. So, we're talking about developing some new modules. In fact, I alluded to one at the beginning of the show. I read an article in Becker earlier this week that got my wheels turning, that talks about, identifying opportunities by DRG to improve care pathways. And so, I got my team together and we started working on some algorithms to identify these opportunities by looking at cohorts within the communities that the hospitals serve. It takes into consideration the zip code level, the age of the patients, the DRGs, a severity score that we're developing. And the idea is, and also payer mix. And so the idea is to stratify these cohorts and identify for the hospitals opportunity to improve their care pathways by using benchmarks. So, for example, we'll compare a DRG for septicemia at San Antonio and compare it not only to what's happening in San Bernardino as a whole, but also across California and the United States. And so he can see how his hospital scores on that particular DRG. And if it's below the average, what would be expected, he could then look operationally and talk to his internal operational experts and say, is there an opportunity here where we can improve these care pathways to not only improve and provide better care, but do it more economically for us and their partners. So that's one thing that we're doing. In terms of the Inland Empire in general, another aspect of this that's important just from an analytics perspective is the latency of the data, or how real time is it? And so one of the questions we've got since we've started this particular platform that we're talking about, which we call the market intelligence platform, which pulls in all kinds of data from the communities that surround the hospitals throughout California. And then we integrate it with all kinds of other information that we can get our hands on. But the problem with it is it's only updated annually. And it's typically updated about 18 months after the previous year's beginning. So January from 2004, we plan on releasing it sometime in the beginning of 2006. But Inland Empire provides us with a unique opportunity to reduce that latency period because virtually every hospital in the Inland Empire is contributing their data to HQI because of their relationship with IEHP. In addition to that, SpeedTrack recently collaborated with HQI to build an equity reporting platform in response to the state of California's requirement for hospitals within the state to submit an equity report annually on the 30th September. So because of that relationship, the hospitals are uploading their data through HQI and SpeedTrack on a much more recent basis. So we're looking to trial that opportunity in the Inland Empire because of that relationship with HQI and the more recent data that we can provide. In fact, the platform that John is currently using, he has data for his hospital up through the second quarter of 2025 and data on every other hospital in California through 2023. So, it would be nice if you could see that kind of range up with a, 6-month lag time instead of an 18-month lag time. So that's what we're working on now, which I think, especially now with the changes that you've indicated, will be a big help. John, what are your thoughts on that? We really haven't had a chance to talk about it, but I assume data latency is important.
Yeah, absolutely. As we try to improve leapfrog scores, see how we compare, Jeff brought on, hey, we can look at DRGs and average length of stays and who's behind, who's ahead, and why. And, it just might not be best practice, which would be the first thing we would think of. There's also documentation improvement. For every CMI of 0.1 or 0.2, it's worth $300,000 to a hospital. So documentation improvement is where perhaps that physician is not noting all the MCCs, the complications that go with it. So what would that look like? Well, if it were at San Antonio, it would show a high length of stay, it would show low reimbursement, and we would be wondering what's going on. But those two metrics would then tell me, this is a documentation issue. And I wouldn't be able to get to that point without the combination of these metrics together in SpeedTrack.
Thank you for bringing that up. That was the term I was missing a few minutes ago when I was discussing this. When I mentioned the severity score, the component there I was looking for is CMI. So we're also taking into consideration the CMI as well as the length of stay and the geometric mean length of stay, et cetera. So yeah,
You
thanks for
can tell where
mentioning.
SpeedTrack hits, it hits community benefits, strategic planning, financial. I think in the future, when we're able to get all hospitals real time, it'll help definitely with planning and seeing how we're doing to our peers for many of the metrics that are used for leapfrog or star reporting.
That's a great point, John, which actually leads me to my next question, and this is for Jeff. I believe something like that is in the works, right? With something called a data collaborative. Is that correct?
Well, it's something that we've started using that term, particularly in the Inland Empire. As I said, the idea there is, to take advantage of these relationships that we all share in the Inland Empire, certainly between SpeedTrack and our partners like John that already exist in the Inland Empire, the partnership that SpeedTrack has with HQI, and the fact that we've already started working with much more recent data by developing the equity reporting piece and also the quality piece for IEHP. And then finally, between all these hospitals that participate in these programs with HQI. So the data is available, the more recent data is available. So the next stage is, okay, let's talk about a collaborative between the hospitals in the Inland Empire to get together. And the way I'm envisioning it, this is just something I'm imagining right now and starting to socialize with folks like John and Hask, et cetera. But the way I'm imagining it is the CEOs within the collaborative will drive it. This isn't up to SpeedTrack to drive. It's their data that they're sharing. They're going to decide how it's shared, how often it's shared. What I mean there is I can imagine that, hospitals aren't going to want to, other hospitals in the area to see what happened yesterday in their hospital. They might want to see a 6-month lag time, but that's a heck of a lot better than an 18-month lag time that they're getting now on the data. So that's going to be driven by the participants in the collaborative. SpeedTrack is going to serve as the technology partner that hosts and manages and incorporates the changes that the collaborative would like to see. And that's the vision. Like I said, we're just starting to talk about it, and we'll see where it goes. Fingers crossed.
Great. Speaking of seeing where it goes, you probably get this question a lot. AI.
Sure.
It's moving so quickly. I mean, even just in the past couple of years, it's just been ubiquitous, and you can ask almost anybody, and they're using it on a daily basis. Paired with machine learning and predictive modeling, how are you and SpeedTrack planning to incorporate some of these innovations into your platform?
Yeah, obviously that's something we talk about on virtually a daily basis here at SpeedTrack. I have a team that's experimenting with it now. We call it, what we're doing is we're playing with it at the moment. And, one of the traps I think that's easy to make in technology is you're so sure how it's going to be used and what you're going to do next. You put all this planning around it and go do that. And the market shifts and does something else, or that's not exactly what your customers wanted. So we're taking a little bit more circumspect approach. We are very confident that we can build AI into our system, and it's going to work extremely well. The thing is, again, like I said throughout this thing, the recurring theme is it's going to be driven by our partners. And in fact, I expect to be having a conversation with John and his peers within the next 45 days around these things to get their input on it. It's going to be driven there, but also it's going to be driven by, I said from the very beginning, SpeedTrack is a unique technology. It has a very different architecture than anything else that's out there. And got to be careful what I say here, but let's just say that we believe, I'm certain of it, but we believe that by virtue of our technology, it's going to create a very different new experience with regard to AI. And probably, I would imagine John can understand what I'm saying just because he's had the opportunity to play around with SpeedTrack. And it leverages what I said earlier about imagine SpeedTrack as the Starship Enterprise, and you can navigate through the cosmos as you see fit.
Great. Well, look forward to seeing how you're able to integrate it and even enhance beyond what you've already done, which is amazing. Which leads me to you, John. How do you see innovations like AI impacting your hospital's future moving forward?
Well, I'm becoming a believer, especially since my better half always uses AI on me for every question that we have when we're sitting at the dinner table. And she gets the answer like 5 minutes before me looking it up. So yeah, she's a believer and I'm a believer too. However, we do know what won't work with AI right now, and that's it. Physician buy-in to use AI for clinical decisions, not there yet. But where I think AI is there is, hey, being able to look at scheduling, um, authorizations, perhaps easy mechanisms partnering with insurance company on denials, um, giving simple updates to our patients of when their next appointment is. Where I'm not using live bodies. Someone comes with an imaging scheduling concern or wanting to speak to a live body. Perhaps AI can serve that need when I don't have 15 people to take a phone call all at the same time, right? So I see it, AI in hospitals on the periphery. And I think, Carmela Coyle said it right. We have to sift through the thousands of different AI companies out there and see who's going to be left standing and who you're going to partner with. Because if I partner with a novel AI company now, they might not be here tomorrow, right? So I think with healthcare, unfortunately, we have to pace ourselves with AI. For San Antonio specifically, we are using AI for scheduling and let's just say customer benefit in terms of that scheduling and authorizations.
Great. Yeah. When I think about AI in healthcare, I don't know that there's any one sector that should be more protected and be more thoughtful about its implementation, right? This is a human enterprise, and we are dealing with people who are taking care of people and saving lives. And I know it's been used in several cases that we hear about all the use cases as it relates to administrative tasks, as you mentioned. And I know there's probably more hesitation as it relates to clinical decision making.
Right.
And so we just have to be very, very thoughtful, I think, about how we approach that, especially within healthcare.
Absolutely.
Well, Jeff and John, it's really been amazing. It's been an interesting talk. I wanted to ask both of you if there's anything else that you'd like to share with our listeners before we log off here today. I'll start with you, Jeff.
Well, the first thing I want to say is thank you, John, for joining on this podcast today. It's been terrific. You're a joy to work with, and thanks for jumping on. And also, thank you to Hask, George, and particularly you, Adam, for facilitating today's talk. I thought it went extremely well. And then finally, if any of the listeners out there want to know more about SpeedTrack, come to the website. You can contact us through the website, or if you want to contact Hask, I assume a lot of the folks are going to be members of Hask. They can certainly put you through to SpeedTrack and to me directly. So thank you, Adam.
Thank you, Jeff. John, anything you'd like to share before we log off today?
Yeah, my middle name, Thomas. And why am I telling you that? Because I am tough on vendors who come and market and sell things. But, SpeedTrack met every validation concern I wanted, and they proved themselves. Jeff would come down for hours to talk to our executive team, all the way down to our data analysts. And Hask, they're a joy because you do want to get the best practices to all hospitals. It's not just competition, just like it was in COVID. Hospitals collaborating together, could benefit the community and their hospitals individually. And SpeedTrack has that platform to do just that.
Well said, John. On that note, I think collaboration is going to be more necessary than ever before.
Right.
So we appreciate what you're doing, and we appreciate what you're doing, Jeff. Thank you both for joining today and sharing your insights. As Jeff said, for more information, you can visit the SpeedTrack website, which is speedtrack.com, or you can learn more on our Endorsed Business Partner Program, or EBP, as I mentioned earlier, on the hask.org website. Thank you both, and look forward to talking again in the future.
My pleasure. Thank you, Adam.
Thanks much, everybody.
In the spotlight.